Good afternoon, everyone. The first day of May, and we are now entering into the third month of our response to COVID-19. For many people in our community, it has been a deeply worrying, stressful and concerning time. But all of the actions you have been taking have been helping us in the day-to-day battle against this vicious, non-discriminatory virus. So thank you for all that you have been doing and continue to do. It is you and your actions that are making the difference and keeping our Ireland community safe. Before the coronavirus pandemic changed our world, by now we'd be seeing the 2020 visitor season well underway, enjoying the many lovely events organised by communities around the island each spring, and of course we'd be in the midst of the big build-up to TT with all the frantic activity that involves, as the festival would only have been a few weeks away. Life has changed immeasurably. The seasons are the same, but what comes and goes with them, now and for the foreseeable future, is different or no longer there. We have come together as a community in the most extraordinary circumstances to face a global health emergency. You, the public, have accepted the many changes required to meet that challenge. Your willingness to live within the restrictions we have imposed has been exemplary and is very much appreciated. Your buy-in to our collective effort to flatten the curve, protect the health service and save lives has been outstanding. I once again want to thank everyone for their efforts so far. I'm delighted to be joined again today by the Chief Executive of the Department of Health and Social Care, Catherine Magson, who will be giving you an update on our current position. But first of all, I want to share with you today's statistics. The total number of tests undertaken now stands at 3,228. The total number of concluded tests stands at 3,149. That means the number of outstanding test results is 79. The total number of confirmed cases stands at 316. That means there has been one new case since yesterday's update. The presumed recovered now stands at 271, leaving 23 active cases. But it is with deepest sadness that I must announce a further death in our community, bringing the total community deaths to 17 and the total deaths to 22. This horrendous disease has yet again left a family without their loved one. Every death strikes at the heart of our community and touches each and every one of us. And I wish to extend my deepest sympathies and condolences to their families and friends. Turning to the main part of the briefing today, our approach to containing coronavirus on the island has been informed throughout by the advice of our senior clinicians. Data is a key driver. Data informs those clinical decisions and ultimately the direction taken by government in what we believe are the best interests of the public. I promised at a previous briefing that we will publish our data and allow access to our daily statistics dating back to the 17th of March, 2 days before the island's first positive case. I am happy to say that this information is now live on the government's COVID-19 website and can be found by scrolling to the bottom of that website, of the website landing page. You can access it by visiting that website, www.covid19.gov.im, and navigating to the open data page, which, like I say, the link to which is currently at the very bottom of the landing page. A link to this page has been added below today's statistics on the website and so is available for access now. The data is available in a number of spreadsheet and web-based formats and can be freely used and distributed. Those wishing to do so must first read our Open Data Government Licence. A link to this is on the Open Data webpage. So why is this good? And how can it be utilised? Well, it's good because it's yet another avenue for government to be open and transparent about how this virus is spreading. It also gives you the opportunity to pick the information that is most important and relevant to you. You can chart the statistics across the entire outbreak and distribute it however you wish. This could be for business use in staff emails or on your company website, or your own social media feed, for example. Perhaps it will even find its way into school projects. The information is accurate and will be updated on a daily basis. The data follows the format we give out daily, such as concluded tests, confirmed cases, negative tests, pending results, pending tests, and deaths relating to COVID-19 in the Isle of Man. We will continue to announce the most up-to-date daily stats at these briefings. That's all from me for now, so I'll hand over to the Chief Executive at the Department of Health and Social Care, Catherine Magson. Catherine.
Thank you, Minister. Thank you. I think one of the most important things to focus on at the moment is language, and in particular the language about exit strategies and the public expectations about what that means. There's a great deal of coverage in the UK in the last few days, with the Prime Minister advising the public that the UK has now passed its peak. There's also coverage from the UK government that they'll publish a comprehensive plan next week on getting their economy moving, getting children back into school, travelling to work and being safe in the workplace. But perhaps thinking about a more helpful phrase or a more accurate description for the medium term, it is important for us all to accept that coronavirus is very likely to be with us for some time. This will not be a short-term issue. It is very likely to remain part of our daily lives for the foreseeable future, and so, understandably, it will continue to impact how we live our lives. It may seem perverse to talk about a new normal, but there's nothing normal about a pandemic or the tragic loss of life we have seen to COVID-19. Indeed, this pandemic is something not seen since Spanish flu a century ago. The world, of course, is already a very different place now to what it has been. For the modern world, this is a new and uncharted territory. But I by no means wish to paint a picture of doom and gloom. As we have seen, the Isle of Man government has already begun taking small steps to modify the approach and tackling and living with coronavirus here on the island, allowing certain sectors to return to work, offering more flexibility in terms of recreation, which began almost a week ago. And for those of you who have followed events this week and will be aware of the work undertaken to finalise the government's medium-term response to coronavirus, we, DHSC, have been heavily involved, and in particular in preparing how we continue to support COVID and bringing non-COVID services back online. This document will be considered again at the Council of Ministers tomorrow, and I know will be debated in Tynwald on Tuesday. And we must not forget the remarkable achievement of all of you, the whole community in flattening the curve. And someone still relatively new to the Isle of Man, I can say that I have been truly bowled over by the community spirit and collective response of the Manx people in the fight against this disease. You should be very proud of the difference that this has made. Flattening the curve and maintaining this has and will be about saving lives, reducing the number of cases at any one time so that our health and care services are not overloaded. We only have so many beds, so many nurses, so many carers, so many doctors, I could go on, and so many ventilators. Unprecedented, therefore, is the word of the moment, it seems. Really does describe the scale of the change we have all had to put in place, whether personally as citizens or, in my case, in terms of how we structure the island's health and social care system to cope with this pandemic. Perhaps the most important concept to grasp then is that coronavirus is likely to be a linear process, not likely to be a linear process. Our bell curves illustrate a model, but the ups and downs of all that important green line in our graph shows that the reality, there will be more peaks and troughs. There may be times when it is the case of 2 steps forward and 1 step back. You will have heard time and time again in these briefings that everything is under constant review, and I assure you that really is the case. We are constantly monitoring and reviewing. With the return to work of some sectors last Friday is a good example. We are clearly carefully monitoring the health and care implications of any resurgence in the virus. And I know that the Council of Ministers are clear that if needs be, we will move back a step with stricter measures to keep people safe. And we support this approach in DHSC. There is not least at last no silver bullet to tackle this coronavirus. There's no vaccine, there's no current reliable antibody test, but our society is adapting and we will continue to do so over the coming weeks and months. So turning to the current data, we have flattened the curve, but we cannot be complacent. You'll have seen over a few days of no new cases that we've had a handful in the past few days. So coronavirus is still here in the Isle of Man. We cannot let down our guard. Social distancing and hand hygiene are key for those who are well. Dialing 111 and seeking advice is key for those who have symptoms. In terms of the age span, the biggest group of cases is still those between 20 and 64. In some ways, this is encouraging, as we've done a lot and will continue to want to shield older people from the disease. There remains a relatively 50-50 split in cases between men and women on the island, and 57% of the cases are female and 43% male. In terms of the spread of COVID on the island, though our contact tracing process, we estimate about 48% of those positive cases have come from those in close contact with other people. The majority of the others are likely to be a transmission between people in the same household. But this does emphasise the crucial importance, therefore, of social distancing when outside our homes. 15% of the cases are now only related to travel, and 37% of the cases we estimate, therefore, have been picked up through the community, with people going about their daily lives in a restricted way. Another interesting statistic is that we've seen a real decrease in attendances to the emergency department at Nobles Hospital. Bringing in a temporary island-wide speed limit and the stay-at-home message has obviously helped to relieve pressure on our emergency team. However, I must stress the importance of everyone to continue to seek treatment for serious conditions. We are here for you, and the whole team, GPs, dentists, the meds team, social care, community teams, mental health, Nobles, I could go on. We will continue to work incredibly hard to support you. Thank you, Minister.
Thank you very much, Catherine. And can I just echo that message that if people do need to seek medical treatment, they still should do so. Regardless of what it is, they should still be seeking treatment as they would under normal circumstances. The health service is still there to help support you and provide for you. So please, if you do need to seek treatment, do not put it off. Do still seek it as you would have in the normal way. And we'll now turn to questions. And first up, I've got Sam from Isle of Man Newspapers. Good afternoon, Sam.
Good afternoon, Mr. Ashford. Tim Wood this week gave its backing for homeless people to be housed at a couple of hotels in the island while being charged £192 a week. Realistically, is this a long-term policy that's going to have effects on these people beyond this? In some cases, they will be placed into debt because of this, or we're going to be adding to debt that they already have. And if it's being deducted from their benefits, it's further decreasing the ability that they have to actually buy anything without resorting to going into debt in that way. I'm just a bit concerned about what the actual social element is of this.
Well, the social element is actually supportive, Sam. It's ensuring that people who haven't got anywhere else to go, who've been couch surfing in some cases for a very, very long time, actually have a roof over their head. So the benefits system has allowed them to be able to get accommodation, to be able to provide that for them. And, you know, it is something I think we do need to look at long term, potentially as a policy for dealing for those. Because when people refer to homelessness, you always think of people out on the street. But there's also what I've always termed the hidden homeless, which is those that have just been staying with friends, moving around in a circular pattern, doing the couch surfing without anywhere of their own. So I think it is important that we have somewhere, just the same as for other people on benefits. If they are in private rented accommodation, then there is a contribution from the benefits towards that. And it's exactly the same with this situation. It's absolutely no different.
So they might not be paying that entire 192. They may be paying a portion of that.
Yeah, because the benefits will cover it, is my understanding.
Okay. And secondly, it was announced this morning by the Chief Minister that there could be changes coming to the repatriation system. Could you talk us through how that's changed and what's going to happen in terms of that, and where the level of fairness comes in terms of that these people will now not be charged, of course, returning to the island, except for paying for their travel, whereas other people have been. People who've been in the hotel this week have said this is a bit of a kick in the teeth to them.
Well, we have said constantly that everything is kept under review. We've said continuously that the policy on quarantine is absolutely no different to any other policy, that it would be reviewed on a fortnightly basis. That has been done by the clinical management group, but we've still got to work out the details in order to come forward and publish. So I'm not going to announce here at a podium today what the policies are going to be. The Chief Minister laid out that there has been some changed recommendations from the clinical leadership group. They've been to council and ministers. We will now work up a policy that we will be able to share with Timble members and then with the wider public. In terms of that, there was always the likelihood that one day the policy was going to change. Quarantine is never going to be in place forever. Equally, in years to come, self-isolation won't be in place, hopefully, eventually. Things constantly change, but we've made it quite clear throughout that those that wish to return during these times had to come back via the quarantine process, and that was for very, very key reasons. As has been explained many times, one of the most infected countries now is the UK. In terms of its viral load, it's one of the biggest risks to the island, as the Chief Minister laid out at the committee this morning. So decisions had to be taken in those early days that we wanted to see our residents back, but we had to do so in a clinically safe way for the island, for the people already on the island, and also for them. But policies are constantly under review and they will change.
So can I just clarify that? Has the Council Minister discussed whether people coming in after this will come in via Heysham, or could there be a potential to come in from other areas?
I would expect, like I say, the policy is all still being worked up, Sam, so I'm not going to start making policy announcements today from the podium, but I would suspect that the boat will still be used, because one of the key things around this with repatriation is social distancing, and obviously it is much more, it's much easier to do social distancing on the boat from Heysham than it would be via a plane or something else. So the recommendation would be to continue, and also I would expect the recommendation, when it is finally worked up, will continue with the limited numbers. So it will still be limited to a certain number a week to make sure we can bring people back safely without having an impact on our wider community.
Thank you.
Next up, I've got Amanda from Jeff the Mongoose.
Thank you very much, Minister. Just to build on Sam's question there, could you explain a little bit about what the changes are that seem to have brought about this potential change in policy? Like, what is this new data, this new information that's driven that?
Well, the fact is, the number of cases we've been seeing on the island, we were very clear from day one when we drew up the repatriation scheme and the quarantine that any changes would depend upon the viral load in the community, because the purpose of the repatriation was to make sure that we didn't end up with what I've been terming a second bounce effect in the community, with a second set of viral load on top of what we've already got. We know how infectious this virus is. We know how it multiplies very, very quickly across a community if left unchecked. And so that was why that measure was taken. As we've seen from the case numbers over the last couple of weeks, just as that allowed us to make decisions last Friday around certain industries returning, that's also made us able to look again at the way that we repatriate people. So it's been medically driven by the data of what's actually going on in the community now that we've got some more long-term data. And I think I did state at this podium about 2 weeks ago that we would review the quarantine position 2 weeks in, and that's exactly what we've done. I don't know if Catherine wants to add anything to that.
No, I completely agree, Minister, and I said this morning in the Public Accounts Committee is that the initial discussions actually took place on the 1st of April. If you think about it, the review and the process and everything we talked about earlier, and I referred to earlier about monitoring, reviewing, it's an iterative process. Everything that we do, we're constantly undertaking that work, and that applies to those that want to repatriate in any other way as other policy decisions and recommendations that have been made. So we were last week able to make some decisions around the measures. As the Minister said, we've got much clearer information. We have a much better picture of where we are in that curve, and that applies just as much as it does to the repatriation recommendations. It does to many of the other measures that were spoken about last week. So it's part of the process. It's what we agreed we would do, and will constantly do to support the work of Komen in making those decisions.
I mean, I hate to use the phrase again, Manda, because some of you have probably got it on word bingo for me, but baby steps along each way, along each point, and this is yet another baby step.
Thank you. And secondly, we've had, I believe, 8 new cases in the last 4 days. Can you give us a breakdown of where these new cases have originated from, such as the hospital, care homes, or general population? And if these are in clusters, as it'd be beneficial to know the areas of the island that transmission seems to be prominent in?
Right. Well, my maths might be wrong, but certainly over the last few days, I get it to 7 cases.
So with the new one today, it was 8, but I could be wrong.
With the new one today, it's 7, I think, on my maths. But of those, 2 look like they've got an Abbotswood link. There's one with travel history who was already self-isolating at home. There was one who was an admission in hospital. There's one link to another case, and then there's 2 that are in the community. Tracing's underway, but at the moment there's no obvious link with 2 of them.
Thank you very much.
Okay, next I've got Tim from Manx Radio.
Best of my Minister and Chief Exec. Just before I ask my question, can I just confirm that the death that we've had, and obviously our hearts go out to their family and friends, is this related to Abbotswood again?
Very tragically, Tim, yes it is.
Thank you. From tomorrow, Guernsey's allowing households to expand their bubble and meet up with one other household without following social distancing rules, even with people over the age of 65. And also you can meet up with one other person from outside your house for outdoor activities, as long as social distancing rules at that case are adhered to. Are there any plans to do likewise? And I hesitate to put my maths on the line here, because I think I work out, apart from those in hospital, there's only 2 cases outside of hospital now.
Well, can I say, Tim, at the moment, no, there isn't. I know all the jurisdictions are looking at various different options. Scotland's discussed the bubble effect as well. At the moment, there isn't in that regard, because while we look at what other jurisdictions do, we have to consider what's best for the island. And as I keep saying, we mustn't get fascinated by the statistics at any one time. The fact we have had more cases emerging shows there is still that level of community transmission that is going on, and we mustn't do anything that that jeopardizes and sends us in the other trajectory. You know, it's very easy now when you see low numbers of cases, it's very easy for pressure to build, for people to say there's only a couple of cases, everything's fine, let's release and do things differently. But one of the things, if you look around the world, social distancing and also the division of households are 2 of the most effective measures at stopping the spread of this disease. And it is absolutely crucial that we stick with that. So there isn't at the moment any plans for that. But again, as the Chief Minister and myself continuously say, and again, it's probably on the word bingo somewhere, everything changes day to day. It's continuously changing, and all of our policies are under constant review. And again, I don't know if Catherine's got anything she wants to add there.
No, the only thing I said, I think the next key point obviously will be 2 weeks from when we made the changes on the 23rd last week. So the 8th of May, that really is the next anchor point, and that's what we'll be working towards. That's what the medium-term response document the Minister referred to, and the presentations that will be given next week. So we'll start to give people an idea of what that feels like, what that might look like, but it is going to be dependent on, as the Minister says, what happens between now and the 8th.
Okay, and next I've got Leanne from 3F. Oh, sorry, Tim, you haven't had your second. You paused then. I was thinking I'd miscounted.
I was just going to say I've got a full house here as well, just to let you know on the bingo front. The earliest any potential vaccine that we're hearing about that could be available is September, and that's being very optimistic. So a simple question, are we going to keep the borders closed until we've got a vaccination programme up and running on the island?
For the foreseeable future, the borders will be remaining closed. Vaccination-wise, I see the press are reporting some wonderful stories around there may be vaccines ready in September. But equally, we've got to remember there was wonderful stories about antibody tests and everything else coming online in May, which we are now in. Vaccines still have to be tested, they still have to be trialled, they have to be shown to be effective, and there's some reports that say there won't be a vaccine until next year at the very earliest. If indeed, as I say, because we don't still have a lot of information around COVID-19, there is a vaccine that is developed that is effective at all. We still aren't 100% certain on that there will be. But in terms of borders, that will be one of the last things I would expect us to change is our border policy, because that is the one that has the greatest impact. As an island, we've been able to take decisions and large steps that other larger jurisdictions haven't been able to take. And one of the most fundamental of those has been our border policy. And again, you only have to look back to the data and when we did the border controls and the impact that had on the data set going forward. So although it's a mix of things, border control is a very clear policy. So at the moment, there are no plans to revise that, and we will wait and see. But as I say, everything keeps changing, to add to your word bingo again.
It's just to give a context for people to understand, it's a long haul, isn't it?
It is a long haul, and I think I've got to stress again, COVID-19 is not going anywhere. It's not going to be eradicated anytime soon. It is going to be there. We've got to use that term that keeps being used in several jurisdictions, learn to live with COVID-19, living with COVID-19, because we've got to accept it could be around, even if in low levels, for a substantial period of time to come. Okay, next up, Leanne from 3FM.
Good afternoon, Minister. My first question, the new domestic scheme between Tesco and the police launched this week. I was just wondering, is this something that the health department is also involved in? And if so, have you had any feedback from it yet?
It is something we've been involved in. I'm not aware of any feedback yet, but I'll hand over to Catherine in a minute who might be. I think it's an absolutely excellent scheme, I have to say, and I want to commend all those who've been involved with it. I think it shows cross-sector working at its best. And hopefully it will give an opportunity for safety for many people out there who otherwise would be scared and at risk in our community. But I'll hand over to Catherine in case she's got any information I haven't.
Yeah, so we were part of the co-design and co-production of the idea across government. I think you'll find that the letter actually that went to the very vulnerable, was actually come from myself that introduced this scheme. We've actually had more and more people ask if they can be part of the scheme as well, and we're going through another cohort with primary care to start to look at other vulnerable groups that we could include. So there's a lot clearly of work to be done, but it's the first step in the journey here to consider to build that more infrastructure, community infrastructure on a more formal basis with particular cohorts of groups. So yeah, we've been heavily involved, yeah.
Okay, and my second question for you, Minister, I know in regards to the island's 6-stage plan, I know you can't talk about specific dates, but we've just had a few queries, so I thought I'd put it forward anyway. People are asking, do you know which stage the opening of things such as dentists and doctors will fall under?
Well, the department is working around our services. So what's got to be done when you're talking about medical services is it's got to be done in a clinically safe way. Now, obviously, when it comes to dentistry, there are an awful lot of basically aerosol generating procedures. So that makes dentistry quite a risk of infection. So while there is plans being worked up across the department, they've got to be done in a staged way. So the detailed stage plan is going to focus more around the economy and the social aspect rather than it being a Department of Health plan that's going to list our services and when they turn back on, because that's a medical decision. As I've stated at the podium before, and I think we've heard from previous briefings, we are assessing all our services that we've shut down, but it's really got to be a risk-based approach. And at the moment, we're not quite ready to press that button to turn those services back on at this stage. But what you may find as well with several services is exactly as I've described with the social aspect. You're not going to go from where we are now to bang back to normal. It may be a staged approach where even within services, you'll see certain parts of that service coming back online, the less risky aspects, but other aspects not being released until later on. But again, I'll bring Catherine in case there's anything she wants to add.
Yes, it's a very live discussion. We're starting the planning at the moment. I talked about earlier of us living with COVID and our COVID and non-COVID services. We're actually doing quite a lot of that initial risk assessment this week and into next week. And to start to shape our ideas. But it's uncharted territory for us. We're going to have to be really careful about how we switch back on and in what order. And actually switching on is probably harder than the process we did of switching off services in all reality. It will be a risk-based approach. It will clearly focus on those that are semi-urgent and urgent cases, particularly around cancer, for instance. A lot of that may also be linked to the work that will happen in the UK. Primary care, definitely, GPs themselves, I know are at the heartbeat of the holders of the registered list and everything that's going on in the community in relation to health and being able to refer elsewhere. But they've been absolutely working incredibly hard in order to be able to maintain a different way of working and providing that primary care. We're going to be working with them, and then also dentists, ophthalmologists. We've got calls with dentists next week, and I know they're discussing even this afternoon about how they start to turn on different elements of the services that previously been switched off. How do we focus on what have previously been emergency care only in some of those provisions to areas that are able for us to deliver, still respecting the fact that we're going to have to be very careful around PPE. We're going to have to be very careful around social distancing and what we can do safely for not only the patient but also the professional treating. So it's a very live discussion. We will come out and talk to everybody. We'll do it in a very transparent way. But managing that and managing COVID and peaks and troughs in COVID is incredibly difficult. We don't have all the answers, but we're going to have to do it in a very carefully managed way in order to be able to get this right.
And I think just to add to that, Leanne, one of the other things when we're talking about services across health is there is a certain level of interdependency as well. Some services rely on other services being active. And if part of that interdependency isn't active, then that means the other service can't restart. So we have to look at things like that as well. And, what other services that service that you're wanting to turn back on is dependent on what is the ability of the other service to cope with increased demand. So that all has to factor in as well. So it's not an easy process. As Catherine's just said, it is actually a lot easier to stop doing something than it is to actually restart something.
Thank you.
Okay, and next up I've got Simon at Business 365 magazine.
Good afternoon, Minister.
Afternoon, Simon.
A couple of questions, if I may. Yeah. We're hearing much in the UK today about the R value. That's the number of people that one infected person will pass the virus on to. Now, in the UK, they claim it's fallen from, I think, R3 down to around 0.7. By comparison, what is our R number at the present time?
I'll bring Catherine in a minute, but it is below 1. Because we are seeing anything below 1 is basically means that the infection is decreasing. And as we can see from the stats, it's going down. So the UK was up at the 3 level, which is the average level that it's believed this virus can multiply at, which is one person would be expected to infect 3 others, and so on and so on. Once you hit 1, then one person's infecting 1. Anything below that, the virus is actually in retreat. So ours is below 1 on the R, but I'll come to Catherine in case she's got an absolute accurate figure, which I don't have.
I don't have the exact number as it is, but we actually have been well below 1 for some time, as the Minister says. The issue generally for us around RO is the statistical significance of the volume of cases that we have here, and it makes it actually sometimes an inappropriate measure for us to use. So it's one of a many blend of different things that we look at, but it is well below, in fact, less than 0.5 generally. It has been over for some time. As you can see in the graph, in the green ways, it's sitting on the bottom.
Okay, thank you. My second question, if I may, I'd like to return to the issue of testing. Now, it's generally accepted that testing is the key to eradicating COVID-19 eventually. Now, in the Isle of Man, our testing ratio is obviously better than many other countries, and it's great that we have our own on-island test facility. But how close are we really to its 200 a day capacity? And should this now be the number one priority?
Well, it's a very excellently timed question, actually, Simon, because the department's been working on a testing strategy, which I think I've alluded to again at previous conferences. That testing strategy, I believe, is due to go before the Council of Ministers tomorrow morning. And from that, we'll then be rolling out what I've spoken about in previous press briefings around key workers and the various things we want to do there, and the wider things around nursing homes and those vulnerable in society. But again, I'll hand over to Catherine in case there's anything she wants to add there.
Yes, thank you, Minister. Again, as part of this constant review of how we do things and monitoring, and linked with the on-island testing, which only started actually not so long ago, if you remember, but we've been very pleased with the outcome of that and the results and the way things are going. We've been working up a new and expanded strategy to suit which is just over 200 a day. The capacity is 200 a day. And we're taking that to Comey tomorrow, and I know Dr. Conn, who's the microbiologist, is going to be in the press briefing on Monday to talk you through the implications. All positive steps, and we're confident we'll be able to respond to it and meet the needs.
I mean, the important thing from my point of view as Minister, just to add on the end, Simon, is that any testing should be done for a relevant purpose. So it shouldn't just be randomised testing. It should be there to meet a gap that isn't filled at the moment. That's the point of the testing. It's got to be able to give us something useful, not just going out and randomly testing for the sake of it to use up the capacity. It's got to be focused on actually delivering something for us. Okay, and next up I've got
with specific groups before it moves on to the general.
Yes. So we'll be looking at key workers and so on, as I've said in previous briefings, groups of key workers, and working up from there. But the testing strategy, as Catherine said, will be going to Council of Ministers tomorrow morning for approval, and from there we'll be able to, in the UK words, ramp up. Okay, next up I've got Paul from MTTV.
Okay, thank you.
Thank you, David. Just before I start the question, travel history, you said one of those cases has travel history. Can you put some meat on the bones? I mean, seeing that we've been locked down for this amount of time, how do we have someone, is that a key worker that's caused that or what?
I can't, because it will identify the person, unfortunately, Paul, because we've only got one. It's nothing to be concerned about. It is someone who hasn't been out in the community. They've got a travel history linked with the UK, but they've been self-isolating at home.
Okay.
That's all the information, unfortunately, that I can give.
Fine. Now, with this data being released, obviously, I was talking to somebody who initially, of course, you rang 111, you were told to self-isolate, you didn't get a test, you waited 14 days, then if you still had problems, you got the test. So he got better and therefore fell under the radar, and you accept those. I think everyone does. There's many people who probably had it who don't actually know officially that they've got it or had it at all.
Yes, I've said that from day one. I think I've been asked that before. The point is that with testing, again, people get confused about the purpose of testing. The purpose of testing is to break the chain of the virus. So it's not just simply to tell someone they've got it. It is about breaking the chain. So if it's someone who's been out and about in the community, it's about identifying people they've been in close contact with and breaking the chain of that virus. That's what the testing is around. But yes, there will be people. There's lots of people who get very mild cases of COVID-19. Even there's been cases where people don't really show symptoms at all. They think they've just got an ordinary cold or something like that, or they're feeling a bit lethargic, but they will have had it. So testing is never going to be the total expanse of the spread.
Well, part B of that then would be now that there's no delays, because obviously there was a massive amount of problems on a waiting list. Now there isn't that, issue. If people ring 111 and they think they've got it, will they get a test, or are they still given the same advice just to self-isolate?
Yes, they're still given the same advice, Paul. The advice has not changed. It is around what symptoms they are displaying.
Okay. The other question from a viewer, and they obviously, something in medical, they know what they're doing, I think, because they say they went for the COVID test in the grandstand and they only did the front of the nose swab, and a throat swab. And that is what they were expecting, because it should be the back of the nose where the virus resides. And this is, someone says, I categorically say that's what should have happened. Can you please ask Mr. Ashford why they're not performing the test to that degree?
Well, I'm not a medical clinician, Paul, so I most certainly can't answer around the swabbing. I don't know if Catherine's got anything to add, but certainly I'm not a clinician, so I would have to ask that question and come back to you. But I'll bring Catherine in case she's got any wonderful medical information that I don't have to hand.
It's impossible to say, isn't it, without understanding that particular case and the circumstances. But maybe that's a question for Dr. Khan on Monday. But we're very comfortable. We've been doing a lot of work around prior to turning on the on-island testing, around our ability to take the swabs, our confidence levels in those swabs. We did double swabbing to test what Manchester were getting, what we were getting. And actually, we were actually in a better position than we thought. We actually had one case that I hadn't picked up, that we hadn't picked up. So in reality, we're confident that the process is strong and is clearly working in relation to the stats that you can see, and the ability then for us to contain the virus and suppress the curve.
Okay, next up I've got Josh from ITV.
Thank you, Minister. Today, Downing Street have issued a statement saying face masks have a weak but positive effect in reducing transmission. We know it's an individual's choice here on the island, but couldn't the government be encouraging wearing face masks more if it does have a positive effect? Well,
I think what you'll find with the UK advice is it actually sticks with what it says, which is there is limited scientific advice in this regard, that it states that it's not of benefit to the wearer. But it has there's limited science that says that it may prevent those who are asymptomatic at a low level from passing on the virus. But my understanding is the advice that's come out of the UK, they're a few days behind us, because the advice we changed to and published the other day is exactly what they've gone for, where they're basically still saying it's individual choice. They're not mandating it, certainly from the news story I saw earlier. They're actually following what we issued on, I lose track of the days now, but I think it was Tuesday.
Yeah, but the point where I was trying to get across was that if it's a positive effect, shouldn't the government be encouraging it more than just saying it's your choice?
Well, no, because again, the scientific evidence is exceptionally limited about how much effect wearing face masks actually does have any effect, so no, we're saying it's individual choice. If people wish to wear masks, then they can do so, and we've given a guide to people if they want to make their own masks, but we are not going to mandate it. And like I say, that is the position the UK is now caught up with.
Okay, my second question is researchers in South Korea have said today they believe it's now impossible to get the virus twice. What's the current stance in the Isle of Man government is taking on this? And if this is the case, how would this change the Isle of Man response?
So I think this is around South Korea, possibly the 141 people where they thought someone might have recaught it. There was issues around how quickly after they'd had it, the second tests had been done with the virus shedding. I haven't seen the full details of what they've come back out with today in South Korea, but our stance at the moment is it's still too early to say. This is a brand new virus, and we don't know how it acts. We don't know if, like some viruses, it means that once you've got the antibodies in your body, then you can never get it again. Or if it's like other things, such as the common cold, where it comes back and you can have it more than once. Time will tell, and I don't think anyone with any certainty this far into a pandemic can honestly say 100% with certainty that yes, if you've had it once, you'll never get it again. Certainly that doesn't seem to be much evidence I can see. And certainly if South Korea's now come out and said that after that 141 sample they were looking at, that people have had it again. But I still personally, with my cautious approach, think it's far too early to be saying things like that. But I'll bring Catherine in.
No, I completely agree. We continue to follow the science around the world, as you would expect. We're involved in a number of conversations, whether that's the UK or more broadly, and it is far too early to say. Nobody will know. Nobody doesn't even understand the seasonal nature of the virus either yet as well. So, but as we've suggested, we'll continue to make sure that we try and maintain we're one step ahead. And we will continue to monitor and review all of our policies in order to be able to meet what is unprecedented demands and needs of this virus.
I mean, obviously, Josh, we all hope and pray it's correct that once someone's had it, they can never have it again. But we'll always take a cautious approach to that.
Thank you.
OK, next up, I've got Chris Cave from Energy. Chris?
Good afternoon, Minister. Just expanding on a question from Amanda, really, to start with. As restrictions are eased, are there any plans to release regional data of coronavirus cases in the Isle of Man, similar to the way they do in the UK? I know we're a much smaller jurisdiction, but could that not help contain the virus once we do start getting back to normal?
Well, the data at the moment, certainly I have it, as I said, I think I've said before, and we've shared this with the postcodes. That's the only way we can really break it down is by the 3-digit postcode. At the moment, the data still isn't showing anything worthwhile. You've got a large proportion in the IM9 category now, but of course we have to remember that IM9 includes Abbotswood. IM2, once you take that out, is the next highest, which I've referred to a couple of times. But again, it's got one of the highest population densities, the IM2 postcode, if not the highest. So there is nothing at the moment in the data that shows it as being worthwhile. And with us being a small jurisdiction as well, while the UK can publish data, their data, even in their small clusters that they're publishing, population-wise and area-wise, is an awful lot bigger than what we are in a totality. So at the moment, there's nothing really worthwhile coming out of the postcode data that anyone can really analyse and extrapolate anything from. But again, I'll bring in Catherine in case she wants any comment. Oh, I think she's frozen on us. So we'll come back if she wants to comment on that. And we'll move on to your next question, Chris.
Yeah, it's another Friday, a day where in a pre-lockdown world, many will be getting ready to enjoy a weekend, socialising with friends and family. The number of confirmed cases hasn't risen drastically over the past week or so. People are beginning to go back to work and restrictions on exercise have been eased. I know you can't give dates, but can you give us a rough idea? I mean, according to your latest forecasts and medical advice given to government, are you able to offer people a glimmer of hope as to when we may be able to go out for dinner at a restaurant again, when we might be able to go to cinemas or meet up with our mates for a pint at the pub?
Well, you'll actually see all that in the strategy documents when it's published in the various phases as to when we consider we'll be able to turn on bars and restaurants. You rightly say, Chris, though, there's no dates around that because we've got to see where this goes. We've got to take things a step at a time. I'll do the word bingo again and say baby steps again. But we've got to take it in a very, very slow manner. And as we've made clear, this isn't one way either. If the data starts showing that we're getting spikes and we're going backwards, then we will have to reconsider steps already taken. And if we need to start looking again at those steps and maybe even reversing. So we've got to be very, very careful around this. I know it's frustrating, as I think I've emphasised many, many times. The way we live has completely and utterly changed. And as human beings, we're not used to living in the environment we are now. So that does create tensions. But at the moment, it is far too early to say. And restaurants and pubs certainly will be in the later phases. There's a long way to go yet.
According to the advice given to you, though, do you have a relative idea of when such places will start to reopen, whether you're willing to share that information at the moment or not?
I have an idea of where it's going to be in the phasing. So when the strategy document is published, there'll be 6 phases. But no, in terms of timescale, we don't, because as the Chief Minister has emphasised time and time again, there is no timescale on these phases, because if we do something, if we take an action now, and as I've said before, it can take up to 8 days for it to feed through into the data, and we find that action has spiked the case numbers or it's having an adverse effect, then we either need to consider pausing or even whether we need to unroll some decisions. So it is absolutely physically impossible to put timescales on it. So I can't say 6 months, 9 months, 3 months. That's just not physically possible. When you see the strategy document, when it's published publicly, you'll see that everything is in different phases. So you'll be able to see at any one time from the announcements we make where we are in the plan. But there isn't absolutely no firm dates around that. And Catherine is back with us. So yeah. I don't know if you heard Chris's first question, so I don't know if you had anything to add on that.
Yeah, the question about the maps and the geographical and So I was just about to say before, sorry, everyone got frozen out. I think that was my end. So in reality, we do actually have that information. Clearly, as you would expect, it is driven by geographical density, but the actual numbers, because our numbers of cases are so low, we are working at a much smaller level than that. And the impact of our contact tracing, which we've talked about testing earlier, but actually the benefit comes from tracing that through right to the nth degree, working out where all the links are, and then stopping the continuation and continuing transmission of that virus. That's actually where the work of our team spend most of our time and where we focus on, and that's what will have the biggest impact. So just showing them by postcode will probably not add any value. It's much more further detail, really down at patient level, resident level, and all the intricacies of those contacts that really is going to make the difference.
Thank you.
Okay, and then last up, I have Alex from the BBC.
Hello, Minister. Obviously, following the sad news of another death in the Abbotswood cluster that you've announced today, do you still consider that it's too early to open a formal investigation into what's happened at the home?
There are investigations inquiries ongoing, obviously. I'm limited in what I can say, Alex, at this time. As I've stated at other briefings, there are things in play. DHSC has stepped in to assist the home, and that is as much as I can say at that time around that.
Okay, I appreciate that. Thank you. On another point, we've been seeing in recent days, a lot of the questions today have been focused around the international press and other countries' responses. I now see Spain has laid out a formal plan for getting its tourist economy going again. Some of the Canary Islands, there are plans certainly to reopen by October. So we may find ourselves a few months down the line in a situation where other countries, I should say, opening their borders to tourists, and the Isle of Man's borders may still be closed as the UK's borders expand and open again. So this might leave the Isle of Man, firstly, in a position where Manx passengers might find it difficult to honour holiday bookings that they've already had purely because they can't get off the island. And secondly, the Isle of Man might miss a crucial opportunity to crack the kind of restarting of the travel and tourism industry. Is this being factored into considerations?
Well, Alex, as I've said all along, the key thing here is we will look at the medical data. I've mentioned earlier that border control will be probably one of the last things that we would relax, because it is a tool that we have that can control what comes into the community in terms of viral load. Other countries have to make decisions that are right for them. The decisions we make here will be the decisions that we believe are right for the Isle of Man. Now, obviously, the tourist industry is one of those that has suffered the most because they've effectively been shut down by this in entirety. And it's important to recognise that, but we've got to make sure that what we do is medically safe for our island and that we do it in a controlled way, not just looking at saying because someone else has done something, we'll do it. With many of the actions we've taken, we've actually led the way. We've been ahead of other countries in taking certain measures, and that includes actually releasing certain measures as well. But what we've got to do is we've got to do it in a considered manner, not just considering whether Spain's doing something, because there's nothing to suggest that you may not do something and cause a second spike, and that's the very last thing we want to do. So, you know, as much as I know there's probably a lot of people listening now, particularly those involved in the tourist industry, hoping against hope that I'm going to say, yes, if Spain reopens, if France reopens, we'll follow suit. I'm afraid I can't give them that reassurance, because we've got to do what we believe is right in protecting our island community.
Thank you, Minister.
Amanda, you've got another question?
Yes, Minister. As we've spoken about a little bit earlier, the testing policy is to test as often as possible, but there will be some people who are asymptomatic and will be slipping through that net. Does the government have an estimated percentage or number of the population who they believe has been infected since the pandemic started?
No, and I would say that's absolutely impossible to do. It's impossible for any jurisdiction really to be able to do that because, as I said, you've got some people who show exceptionally mild symptoms. I believe some of the studies around the world have shown that in the case particularly of children who might have had it, they've shown next to no symptoms whatsoever. So I don't think that's a number that will ever be able to be quantified unless you actually develop a 100% accurate antibody test and you can test the entire population. That is the only way you'd ever really be able to quantify that. But I'll bring Catherine in case she's got anything to add there at the end.
No, I completely agree. And we've always known, as we've said from the start, that a lot of people may not even know that they've had the virus or have had some relatively mild symptoms that they wouldn't even describe as COVID-19. So it's going to be impossible to say, as the Minister describes.
Sam, you've got another question?
It was just a question on terms of these next steps. We were told to be published by the end of this week. When are we going to expect to see them?
Well, I believe they're going to Tynwald members tomorrow, so they'll be going public. I believe now the plan is for Monday, because they won't be going to Tynwald members till tomorrow. And out of courtesy to Tynwald, of course, we want to ensure that Tynwald members have a chance to read through them first, so they would before they're public. So they'll be public, I would imagine, on Monday, I think, ahead of the Tynwald debate on Tuesday. Okay, thank you very much. Turning to today's shout-outs, you will have heard the Chief Minister say many times that our battle with coronavirus is a marathon, not a sprint. One local athlete, Christian Varley, has taken the message to heart and has set himself the challenge of attempting to run 19 marathons in 19 consecutive days. And this is in aid of the Manx Solidarity Fund. Christian started his first marathon today at 12 noon, where he was flagged off from Peel Castle by the Lieutenant Governor, His Excellency Sir Richard Gosney. Today's route takes Christian out of Peel along the Douglas Road to the War Memorial on Douglas Prom and back. He will be running a different route around the island each day. Christian is going big and aiming to raise £19,000. His epic challenge epitomises the Manx spirit of resilience, perseverance and determination. Well done, Christian, and good luck. The island is most definitely cheering you on. To date, the Manx Solidarity Fund has raised over £215,000. My thanks to everyone involved with this very worthy project, and also to those who have, of course, given so generously to raise that money. Secondly, today, we have Wayne and the rest of the hospital maintenance team. They've been doing long hours over the last couple of months, helping to get the hospital ready for the pandemic. Wayne and the team have had to go on the COVID wards from time to time to undertake maintenance, and Wayne and the team have always gone that extra mile to help. So thank you, Wayne, and thank you to everyone involved with maintaining our health and social care estate and equipment. The role you undertake is absolutely vital at the best of times, but even more vital as we fight this worldwide pandemic. Thank you very much. Also a request for a shout out for the volunteers of Arbory and Russian Connect. This community support group was set up by Arbory and Russian commissioners as a response to the COVID-19 crisis. 110 volunteers have registered to help, and around 200 people are receiving direct help with shopping, prescription collections, pension collections, letter posting, dog walking and the like. 40 volunteers check routes in the parishes 3 times a week, with households using traffic light coloured cards displayed prominently in parishioners' windows. 2 volunteers stand out in particular who have helped with a resident who has really struggled during this time. Someone who has no family here, lives alone, has various health issues and has had to self-isolate. She was scared and confused and alone. Rachel Kringle has been visiting the resident 3 times a week, chats to her, helps her with shopping and other jobs, and alerts the commissioners to additional needs the lady has when she personally cannot help. She has gone above and beyond what is expected of her. She organised for another volunteer, Andrew Tilley, to walk the lady's dog daily. This support has helped with the ladies' physical needs, but just as importantly, lifted the ladies' spirits immensely. To Rachel, Andrew, and everyone volunteering with Arbury and Russian Connect, thank you very much. A truly amazing story of the amazing community spirit we enjoy on this island. We are exceptionally lucky with all of those that volunteer. So thank you, everyone, and thank you, Catherine, again for joining us today. You'll be joined tomorrow by the Minister for Education, Dr. Allinson, and then on Monday, as Catherine's already stated, I will have Dr. Rizwan Khan here with me. Thank you very much.